Governor Newsom says California is ready to move out of a pandemic and into an endemic. His new plan comes a day after the state lifted its indoor mask mandate for fully vaccinated people. Now, his plan is called SMARTER. It stands for shots, masks, awareness, readiness, testing, education, and prescriptions. The governor promises to provide more supplies and essential tools like masks and testing, also expand lab testing for new variants, and making sure students stay in class.
As we reflect not only on the 2 years, the lessons learned with humility, but we, again, prepare for the uncertainties that lie ahead. The journey we've been on, I think, only reinforces the fundamental construct and understanding that while we can't predict the future, we can better prepare for it.
And joining us live now, Dr. Karen Shavelson, Chief Medical Officer at Marinhealth. So, Doctor, what's your reaction to what the state is laying out? Does the timing make sense to you now and that transition now to an endemic phase of this pandemic?
I think the evidence suggests that it is time to look to move to an endemic phase. I think the public's appetite for stringent controls are fading. We all want to get back to life as normal. And so I think this lays a plan that is well thought out and uses the evidence of the past couple years to do the best that we can. As Governor Newsom said, we don't have a crystal ball. But this allows us some confidence as we start to move forward. And we may take 2 steps forward and maybe 1 small step back along the way. But I think it's a really great starting point for moving into something that looks more endemic.
And part of the plan is moving away from mandates and putting more of an emphasis on prevention and quick reactions to outbreaks. With the risk of new variants popping up, do you think this is the right call?
I do. I mean, time will tell, but from what we're seeing right now, I think this is absolutely the way to go. I think there's a couple important pieces that we need to remember, and that is, as a pediatrician, I have to always remind your viewers, the littlest people are not yet vaccinated. So we need to be really mindful of what that looks like, and hopefully those vaccinations will come soon. And let's not forget the elderly, the frail, the sick, those amongst us who do not have the most robust immune systems. It is our obligation as a community, as a society, to look out for those less fortunate than those of us who might have healthy immune systems. So it may be a bit of a struggle to find that balance, and I think we all need to be flexible and understanding, but I think it's time to try to move forward in a way that captures the best interests of our overall society, but also allows us to try to start living a little bit more of a normal life.
And you mentioned young kids and seniors. Booster rates have been lagging even in the Bay Area, and the issue of the waning immunity. Does it make sense to focus less on the wider population and more on those targeted groups like children and seniors?
Yeah, you know, the deaths that we're seeing are often in the frail or the sick and the elderly. And so as much as we're going to target our efforts, that seems to be the way to go. The notion of a widespread request or demand that people receive boosters or even vaccinations, I think we've seen the best that we're going to see. Somebody who's decided to pass on a booster, I think the odds of convincing somebody in their 30s who's completely healthy to get a booster if they haven't already done so is falling. But rather, if we target our efforts on those most likely to become quite sick or even, unfortunately, die from COVID, that's probably the best use of our resources at this time. That being said, I can't help but as a physician to beg any of you who aren't vaccinated or aren't boosted, please consider doing so. It's not too late. It's never too late.
And there's been a lot of reflecting on lessons learned over the last 2 years. Are there any lessons that you've learned in Marin County that are now part of the playbook moving forward?
Well, I think a really important thing for people to understand is while Governor Newsom's plan is very rich in equipment, masks, ventilators, things like that, and that's very important. What we've come to see during this pandemic is if you don't have the trained, skilled staff to operate the ventilators, Doesn't matter if you have 10 or 100. So we need to be really mindful of protecting our healthcare workforce and our first responders. Whether we all like it or not, we are key to supporting all of you during this pandemic, not just with COVID, of course, but with all the other myriad of illnesses and accidents and things that can happen. So it's imperative that we really look critically at our staffing and how we train the future and what that looks like. And Governor Newsom's plan does include some staffing models, but I'd like to see some more detail on that, because I think at the end of the day, we need the doctors and the nurses and the paramedics and the respiratory therapists to take care of our patients.
Yeah, indeed. We do say thank you to all the people on the front lines and all our first responders. Dr. Shavelson, thank you very much for your time.